Please stand by. Good day, and welcome to the Bipartisan Policy Center's webinar on early learning facilities. Today's conference is being recorded. Today's question and answer session will be conducted over the web platform. If you have a question, please type them into the chat box and click enter. At this time, I would like to turn the conference over to Linda Smith, Director of BPC's Early Childhood Initiative. Please go ahead, ma'am.
Thank you, and I want to welcome everyone to this webinar and thank you for joining us to talk about this issue. Before we get started on the particulars of the policy framework, I wanted to talk a little bit about why we're doing this work and how this work fits into the other initiative that we are taking on here. As many of you know, the Bipartisan Policy Center is seriously looking at how we are going to finance early care and education in this country. That it's clear that we have a gap between what parents can afford to pay for high quality and what it costs to do the work. And so that gap is what we're focused on here. There are three distinct areas of financing that we're concerned about, and we wanted to separate these because we think each of them takes a different and a targeted focus. So the first one obviously is the workforce, and we know that we don't pay the workforce enough, that they are essentially living on poverty wages, and we need to deal with the fact that we have to pay them more. So that gap between what they make and what we need to pay them, that gap is the financing piece that we're focused on in terms of the bigger overarching issue. Within that, though, we think that there are two other areas that need to be looked at, and one of them you saw us start to take on last week when we released the 50-state report on governance. We have been trying to think through how we are going to finance the infrastructure at the state level that is sufficient enough to support programs at the local level. And our 50-state report looked at that and basically how efficient or not states are in governance, and then what are we going to do about that. Then finally, the last piece is the facilities issue, and the facilities on the ground is very distinct problem and challenge because it is such a mixed bag of venues, for example, for-profit, not-for-profit, faith-based, family child care, etc. So when attacking the issue of facilities, we felt we needed a targeted strategy to look at that. So here's where we started. We put together a working group just by inviting a few people to come. And these are some of the people that signed on to this framework that we're going to talk about today, but by no means are they all that participated in the work itself. We had people working with us from various public sectors that simply can't be on a policy statement. So people like the USDA Rural Development Corporation, Fannie Mae, the Federal Reserve Bank of Minneapolis, the Centers for Disease Control, EPA, the Maricopa Association of Governments, and we had representatives from both the Office of Child Care and the Office of Head Start participate in this. So it was a bigger group than you see on the screen, but these folks could all sign on to a policy statement. So with that said, there are a couple of thank yous that we need to make up front. The working group, it goes without saying. Thank you to Barbara Reisman and the Marr Charitable Foundation for their support of this work. They've helped us along the way in moving this issue forward. And finally, from that larger group, we had a smaller policy group work with us on this framework in particular. And a shout out to Nicole Barcliffe from LISC, who was basically the driving force behind the policy, chaired the working group committee, put pen to paper, etc. So in no means do I ever want to suggest that this is purely BPC's work. This would not have happened without Nicole and the other people on that working group, who included Jonathan Horwitz, Grace Reef, Rob Grunwald, Celia Sims, Joe Waters, and Kim DiGiacomo. So we owe a lot to a lot of people, and I always want to be sure that we acknowledge all of their efforts. So moving on to the first slide, here this basically sets the stage for what we think we need to do, that we basically need to have safe and developmentally appropriate ECE facilities, that they're essential to a child's development as well as to sustainable communities. But the truth of the matter is we do not currently have what we need out there, and that goes without saying. So when we started with this idea of what do we have and who do we bring in to work on this. So we started with this interdisciplinary group of stakeholders, some of whom I've already mentioned. And it was just kind of a invite people and who do you think is interested. And as we go through this briefing, I want to make it clear to anyone who's interested in joining this work is free to give us a call, and we'll certainly add you to the list of people we're including in the work. So we started with an interdisciplinary working group, and this policy is a direct result of that. And I think the one thing that we want to make clear to people is that we think that we have really got to take on this issue of facilities, because it's more than just the safety of children, it's actually their development. And I think we've struggled along the way with figuring out how to articulate that, and we've done some work on that in helping people understand that children, for example, cannot learn self-help skills if they can't reach the sink to wash their hands. If somebody has to do it for them, they are not learning how to take care of themselves. So these things do matter to children's development, and they matter in ways that I think we haven't articulated in the past. So let's move on to the next one. The next thing we talked about with the working groups are what's the scope of the problem, and really how big is it? And I think that presents a problem because for sure we don't know how big it is. What we do know, and this slide shows you how many center-based programs we had as of the last early care and education survey done by HHS, and how many homes we have, and sort of the approximate numbers of children being served. A lot of children are in these facilities. Most of them, however, are not designed for what I just said, for children's development. They can be in strip malls, they can be in various and sundry places around our communities. And then there's always the issue of those communities that lack facilities altogether, and some of that work that's been done by CAP in terms of identifying the child care deserts needs to be paid attention to. The truth is we don't have a national assessment of need on this issue, and we feel pretty strongly that we need to, and you'll see that later on. We started digging into what's the scope of the problem and what we could find. You see on this chart here. We looked at HHS and some of the IG inspections that have been done there. Alarming fact that 96% of the child care that they inspected during unannounced visits had at least one potentially hazardous condition. That's a serious problem when those are random sort of basically inspections. We looked at what the EPA has done in terms of their finding that 500,000 child care facilities are not regulated for drinking water and lead in drinking water. Again, a very serious concern given the brain development issues. And in only 8 states and 1 city do they require early learning facilities to be even tested for lead. So we've got a long ways to go on the basics. So let's keep going to the next one. So what is it going to take to fix these facilities? Well, again, because we lack a national needs assessment, we really have only estimates of the scope of the problem. But the National Children's Facilities Network has estimated that it's going to take about $10 billion to upgrade all of our early learning facilities. We know in Head Start that they have done a more in-depth assessment, and they found a need for $1.1 billion just to fix the Head Start facilities that are in need of repairs. So we know that we need to take this on with more focus and more intentionality. The one thing we also are looking at, and we know that some states told us they were going to include facility assessments in their preschool development grant applications. We hope that that materializes because we do need better data, and if we can just get a number of states where we know what the scope is, maybe we can generalize some of that to across the country. So What do we know about investing in early care and learning facilities? Well, we know that there's right now no dedicated funding to support this in any rational manner. So we really have to take that on. You'll see that come out in the policy framework itself. I think the thing that we need to also pay attention to is that this issue of high-performing facilities, and I think what we have come to understand is that we suffer from what I call a culture of low expectations, and we're going to talk about that a little bit more in what the states can do to help us with that. But is it good enough? And I think someone in one of the earlier working group meetings actually put it that way. We just are okay when it's just good enough to get by and pass a minimal inspection, and then we consider that okay. So what we did next was talk about where are we going in terms of a policy framework that all of these groups could get behind in terms of trying to move forward in some kind of manner that made sense. So we put forward, and I need to go back before I move on, and another shout out to Nicole Barcliff because she led this group for us and how important the work was. But the working group, a subgroup, came up with these and put it to the full group for consideration. And in that, we basically looked at what are some of the principles that we really believe in and that we could collectively support in terms of the future of this issue. So essentially you see a couple of those principles laid out here, that every child deserves access to appropriate learning facilities, and that they are a part of the workforce development, economic development, if you will, in our communities, and that we believe that they need to be built into those strategies. Two more, I've been asked the question, well, do we include family child care? And the absolute answer is yes on that one. Although we understand, and the group is very aware of the need to be, flexible and accommodating to family child care. Nevertheless, we need to include family child care homes in the facilities work that we hope to take on. So what we did then was look at the responsibilities for this for facilities and who owns the problem. And I think under the current system, really nobody does, and I think that's part of the problem. And our programs are out there really struggling to figure out what to do with this. In our view, and the view of this entire group, is that it's multi-sector, that there's responsibility at every level, not just of government, but in the private sector as well, including philanthropic, business community, economic development people, transportation planners, housing planners, etc. This is an issue that needs to be tackled by not just the early childhood community itself. So how did we view the federal roles and responsibilities? You can see in this document, and you can read more about them in the framework that's up on our website. But there are multiple opportunities that the federal government can play a role in this. For example, one of the things that we've been looking into is opportunity zones. Is there a way to make these opportunity zones understand the importance that child care plays in a developing community? So there's that. We know that disaster relief funds are a big part of the issue, however, not available to most of our child care programs because they are not available to for-profits. And that includes family child care. Family child care, by its nature, is a for-profit. So we can look for opportunities in disaster funding. We can look for more opportunities in the rural development area, and we have a number of things that we are giving thought to on that. So there are multiple things to approach here, and various roles that the federal government can play. Next, we looked at the role of state governments, and And this is where we think, as I said earlier, that we can change this culture of it's good enough by including facilities in our statewide programs, such as linking not just licensing to the very minimum standards, but as we have looked at other factors in early childhood in our QRIS systems, we need to look at facilities the same way. How do we get from it's just good enough to what really helps children develop? And I think that thinking through our linkages between licensing strategies, health and safety, and child development, linking those to quality rating improvement systems should be a big part of what we try to think through. States also should be looking more at child care deserts. Where do they exist, and what is the plan to meet the need? And that has to include a facilities approach in many of these communities. Collecting data. We really lack data on this issue, and that's why we're hopeful that the preschool development grants will provide us with some opportunities for states to look at this in more in-depth manner. There are, as we know, a few states that have done some work on this. Massachusetts has done it, Rhode Island has done it. A few states have looked at this this facility needs assessment, but we need more states to get serious about that. So now we're down to the local role, and what is the role of the local sector? I was going to say government, but it's everybody at the local level, because this is where the rubber meets the road. City and county planners need to include this in economic development strategies, transportation planners. Community zoning laws are particularly an issue when it comes to family child care, so we need to be paying attention at the local level on that. There are a number of ways at the local level that both the public and the private sector can engage in this issue. One of the big things that we found in the work and in all of the conversations we've had is that child care providers, program managers, directors, by themselves, you know, they're trained in early childhood. They're not trained in finance, in architectural, in design, in facilities, in renovation, in all of those things. And so the problem we're facing is how do we reach out to child care program managers to think through how to help them get better facilities, because by themselves, we don't think that we're going to get there in a community. So who in the community can do this outreach? And there are a number of organizations that can take on this challenge to see if there's something that can be done. But it really is going to take, again, this partnership at the local level. And another organization that we've given a lot of thought to is how do community foundations play in all of this? Community foundations can play a big role in supporting local needs assessment, helping people understand how to get financing, how to get these things working. So there's a role at the local level for everyone. In terms of the private and the philanthropic community, we specifically said that that the philanthropic community can include early learning facilities, and we know of cases where that's being done in Detroit, for example, and in other places around the country, where there's really a philanthropic move to try to tackle this issue of adequate facilities and the deserts. So we think there's a real role for philanthropy in this. There's ways that they can help in terms of fundraising, supporting policy development, supporting needs assessment, research, etc. Finally, we thought that we needed to recognize that there are roles that cross over all of these sectors, and that they are shared both federal, state, and locally. And they include things like economic development strategies both here in Washington and in what comes out of Congress at the state level and at the local level. In terms of including facility quality as a component in everything we do. We should not stop by just talking about the workforce or any one of these issues. We should always include this as we talk about how we're going to get higher quality for our children. looking at research. There's research that needs to be done nationally. There's certainly research and evaluation to do at the state level. And then there's needs assessment and research that can be done at a community level, which if we do enough of this, we can piece some of these things together. But right now we just don't have enough. And then finally, as I mentioned earlier, the financing strategies. And this more or less recognizes that we think there is no one-size-fits-all to everything, but that everybody has a role to play. So we urge you now to take a look at the policy framework and let us know what your thoughts are on it, and if you're interested in coming to work with us on this and moving this issue forward. If that's the case, you can email either Arabella or myself. We'll be more than happy to include you in what we're doing in the future on this. I think what the final thing that I think we'd like to say here is that our next steps of this group will be two things we'll be looking at. First of all, getting together again in the coming months to look at what do we want to propose beyond this policy framework at the federal level. And then secondly, we are going to be taking on putting together for lack of a better term, a guide or sort of an inventory of possible places that people can go for funding, ideas, and models that we've seen as we've done this work from around the country. So there are a number of ways to attack the problem, some of them interesting but never written up. And so in the coming 2 or 3 months, we're going to be working on that. And we're specifically, if you're on this call, we're specifically asking you to share with us ideas that you have. We've got a number of them. I'll give you an example. There's a program down in Atlanta, Georgia that we're interested in whereby an organization buys facilities, upgrades them, and then leases them back to child care. That's something that possibly a community could take on. So we're interested in any and all ideas so that we can explore them, write them up, and share them with other communities around the country. So with that, I want to thank everyone for joining the call and the webinar. We're certainly open to taking questions or comments on this work. I don't think we have a lot of answers. We have as many questions as we have anything, but we're sure trying to work on figuring out what some of these answers might be and how we can improve the facilities around the country. So with that, I'll ask if anybody has any questions. Okay, we have some that we're trying to sort through here. I can't quite see. Let's look at this. Okay. There's a comment, really, and it's more of a comment than it is a question. If you build a center without ensuring we have effective demand, e.g. customers with the dollars to purchase care, you will make the problem worse, not better. Contrary to popular belief, many child care programs have, let's see what we say. I know have vacancies, especially for 4-year-olds. I totally agree that many facilities need improvement, but I think careful data on vacancy rates and the cost of care is needed. We couldn't agree with you more, Louise, on that one, and we've actually had a number of conversations in the working group about this issue of the cost of care, and there's been conversations about, well, the model won't survive if it doesn't have a certain number of children in it. It can survive if we can afford to pay what it costs to do it in a smaller facility, but we haven't started yet to think about strategies to offset those costs between what parents can afford and not. And then you mentioned this issue about 4-year-olds, and we totally agree. I mean, especially in places where there's pre-K. But we also then need to figure out how to make facilities. I think we talk about it in the framework about making facilities flexible enough to be, used for multiple ages. And I think that is a challenge for us because infant care requires so much more than, say, 3- and 4-year-olds. So if the 4-year-olds aren't there, what do we do with the facility space, et cetera? These are problems that I think we as a field need to tackle. And as I said, I'm not sitting here saying we have the answers to them, but we certainly have had conversations about this in the group. Okay, there's one that says, has the issue come up where different organizations have different requirements when it comes to what's best practices? For example, NAYC's requirements differ from licensing. This is a really good question, and one that we have been trying to think through, and it's part of our reason for suggesting that we look at facility standards as a part of a continuum and not an either-or. And I think that when we say it's either licensing or the higher standards maybe of NAYC, we get ourselves into a box here. And what we want to say is that at minimum we need this health and safety, but all facilities should be moving to a place where they are encouraging child development in the appropriate way that I said. So I think that's a good question. It's also one for licensures because inspections, and we touched on this in our previous report on the issue of inspections and multiple inspections. We need for our state governments to get together and figure out what standards we're going to have and how we're going to hold programs accountable, not have multiple standards all applying to the same place. So, have you looked at early learning systems in other countries that have long-standing investments in quality childcare, e.g. France? No, that's a good comment. We have not looked at anything internationally at this point, but I can certainly put it on the agenda for the next working group meeting. That's a great suggestion. And we have another one that says, increasingly state QRS systems are used to define quality in early care and education. However, typically QRS systems do not incorporate facility space standards. That's exactly what we're trying to say here. Are there strategies that can address and tackle this? And it's part of why we put it in here and why we're trying to call attention to it. I think there are, as we move forward with this work, I think we're going to be open to more strategies. I think one of the things that we're going to have to figure out in the working group and those who want to help us on that is if you want to incorporate it into like a QRIS system with 5 levels, what are the different levels? And so it's not an either you're just this, you're good enough, or you're great. But what are some of the in-betweens that can help people figure out how to move forward? That was a really good question. This is interesting, and we'll follow up on this. This comes from out in California, where it says, on behalf of the city of San Mateo in California, we've got a child care impact fee from which we're about to release a NOFA for $2.1 million in facility development. The criteria for a higher performance facilities would inform the review of proposals, but it is really denied. Is this really defined well somewhere? We're not experts. That's a good question, and we've had some comments on that, and we can share some materials with us that have been shared with some of the people working on this at the state level. We do have a couple of examples we can send, and we can link to them after this webinar on our site, but we'll be sure and get those to you. And it is a hard thing. One of the first questions that came up in the first meeting we had was, how do we really define what is high quality facility? And that has not been done. Also, wait a minute. Have you considered that quality family child care does not need to look like Little Center? Yes, we have, and we've talked about that actually in our group. And Bill from the National Association for Family Child Care has been working with us, and we hope to do more on that. It's a hard one. because, some of the basic issues that we're struggling to figure out how to do with are things like lead and asbestos and some of those good enough things, as opposed to sort of the programmatic things that you're talking about. But yes, that has come up. Let's see. We're updating our general plan and working to improve policy related to child care. All ideas with regard to viable policies and goals, related zoning benefits developers too. That's a really good thing to put out there, is these things do. The intersection with developers, whether it's, housing, transport, any of these communities, these things benefit people. We simply have not made ourselves heard in these other groups. There's a lot of economic development stuff going on around the country, transportation planning, housing, etc. And we're trying to think through how we engage in those areas. As you noted, many providers are small business owners. Are you engaging the commercial lenders, banks in the discussions? We have, to a limited extent, not in the working group itself, but we have had a couple of conversations with some of the bigger banks about this issue, trying to get them to think about investments in this area, in part with their CRA money, but how can they do a better job of supporting this in their community. So yes, we've had a couple of those conversations. I won't name the banks, but it has been an ongoing conversation, and certainly welcome anybody's help on that one. Is that? Okay, well, those are all good questions. We're going to take note of all of these and incorporate it into the work as we move forward on this. As I said, if you're interested in joining us, we have another question that popped up. Yeah, instead of banks, have the states been approached to offer low interest, no interest financing? Some states are doing that already, and Massachusetts, Illinois, I think Minnesota, Iowa. There are a handful of states that are doing some of that right now. Our goal is to try and encourage more states to take it on. As I said, it's not going to be any one strategy that fixes this, but it certainly helps when the state actually begins to think about this in a meaningful way. Have you thought about requiring some business electives for those who pursue early childhood degree? I'm not sure on that one. We do know that our field needs to have more, business education on this, and we have been looking at one model that's going on. I believe it's in Massachusetts, where they do an early childhood, sort of like a mini course on, and bring in bankers and architects and different people to talk to early childhood people. An institute, I guess, is what they call it. I'll get that straight. But in any event, we have looked at that, and we really do need to school our early childhood management teams in this issue, because I think part of the problem is that we have been told that lenders are a little hesitant because the margin of profit on an early childhood program, if it's a for-profit, is razor thin to begin with. And then you add on to that the fact that people managing these programs don't really have any background in this. It makes them very high risk. And so we've been talking about how to do that, and there are some models that, like the one I said in Massachusetts. Can we do something more on a national scale, or can we take what we've learned from that one and put it into more state governments? That's something that we've been exploring. But I think it's such an interesting idea to have a one-week policy institute on business, and I hope that kind of gets to what you're talking about there. Some states are doing it for centers, but usually exclude family child care providers since they work from home. I think you're probably right on that, and we keep here trying to pound on the desk and say, don't forget family child care. It's different, but it is a real serious and needed component of early childhood. So, we're with you on that, and I think we just need to keep making the case for family child care for it to be all inclusive. Okay, guys. Well, how can we participate? You can give us, just shoot us an email to either Arabella or myself, and we will make sure that you get on our list, and we welcome people to participate. I think we've had great sessions with really interesting ideas coming out of them, and if we all think this through carefully, I think we can make some headway on it. So that's what our goal is. So with that being said, thank you everyone for joining us, and we wish you a happy holidays, and please go to the website and look at the policy framework, and if you're interested, give us a call. Thanks everyone.
That does conclude today's conference. We thank you for your participation.